Hi, everybody. Welcome to our Wednesday netcast. As you see, we have our guests on board, and we will get started in just a moment. We are certainly in this together, and we're here for another part two conversation with our special guest and son, Jeff Butler. And I thought this is great. You know, Dave and I and Jeff talked about that, having Jeff join us this week, because we noticed in our Facebook, viewing, last week's video got quadruple the amount of views than previous. Now it's
five times as many.
Yeah, your charisma.
It's all credit to me. Yeah, that's for sure.
And here we have, an additional point to our member to our crew. So it's a variety of reasons, but I think the topic is extremely relevant and on top of everybody's minds. So your takeaway from last week, Jeff, was what?
Well, I think it was really a really good conversation to start with both of you. I think, we'd be lying if we said we don't talk. I mean, we talk a lot, but we don't talk a lot about necessarily specifically business and opportunities and sharing thoughts around that. I think that was really valuable. And I also find a lot of value. I mean, I'm sitting here for the last year ruminating on this stuff, researching, looking, trying to find opportunities. And it's nice to share some of this information and hopefully help people out. I think that's my key takeaway, and I really enjoyed the conversation and excited to be back again.
Terrific. David, your takeaway.
Well, I think that what's exciting for me is this is something I've been on the track of for the last 30 years, knowing that there's change going on. It's hard to even imagine what the world was like 30 years ago. I'm talking pre-internet. It was barely a fax machine. I think that was a big deal. So, you can see how quickly things have changed, but the nature of the world is that things around us change. And one of the slowest things to change is work, because it's so deeply embedded in old systems and technologies. It goes all the way back to Henry Ford and the mass production angle, and a guy named Frederick Taylor, who laid out, the job descriptions and how the whole thing should run. And it's so deeply embedded. It's like, the tracks are so down underneath everything that we don't even realize. We think we're doing something different, and we're still playing things out the same old way. Yeah. So I think that this is, what's happened recently has really pushed us over the digital edge. And finally, maybe it's time we could really make a difference and, free ourselves from some of these old patterns, these old bureaucratic ways of thinking about work. Yeah. So I think you're young and new in the workplace, and so you bring a lot of that enthusiasm and insight with you automatically. Yeah. I think there's a lot that we can share that we can help a lot of people with. So, given your specialty, which is healthcare, we're in the middle of a pandemic. Hello.
Yeah, it's pretty crazy. What about you, Mom? What was your takeaway?
The takeaway for me is it reinforces the necessity to, hone in on this remote work. The idea of remote work is one thing, but the stress that goes along with it. So the amount of apps and new ways of doing things, and look what we're doing here with live stream software that enables us to communicate and present. And I think to what we said earlier is that your headquarters of your company is based in Chicago, but it doesn't even matter where people's headquarters are today. So, and what I'm also researching is, like you said, what you're researching is what's happening to the world of work today. Mm-hmm. So the world of work today is not going to be, I hear so many people saying, well, when we get back to the way it used to be, no, that it's not going to be there.
Good luck.
Yeah, it's completely, there may be portions of it, and there may be, some reminders of what used to be, but we have to help people adjust. And the things that I've been reading recently in your field, Jeff, around helping people with this pandemic is the number of people we have to stick with the vaccine. We have to get the vaccine in the arms of people, and what an opportunity for the kind of thing you do.
Yeah, Biden said it last night in his town hall. we got all these doses, but we got to get them in people's arms, and we don't have the people set up to do that.
Yeah, that's kind of where I was going to start our conversation in terms of the opportunities as kind of a vaccine update. Looking at the vaccine rollout, my actual role within Medix is health system support. So I work with our large health system clients in California, and I talk to them about what kind of needs they have on a system-wide basis. But that position was kind of put on hold by my company, and we actually doubled down on the vaccine rollout. We thought, hey, this is an opportunity. We've seen a tremendous boom in business because of contact tracing and temperature screening. Well, the third phase of that is going to be vaccination administration. The challenge that we roll into is this decentralization across the nation that was, I think, established from the previous administration and now is carried over into the current administration, is that everyone's kind of doing their own thing, so to speak. What we've seen is that vaccines have gone from east to west in terms of their how quickly they get rolled out and who's running with it. Recently in the state of California, Blue Cross Blue Shield was basically contracted by the state of California to handle all of the vaccine rollout. So previously it was all the county health organizations figuring out how they can use the fire department and they can use the local health systems to try to administer vaccines. Sure. They said, hey, you know what, let's go hands off. We've got Blue Cross. They manage most of the lives here in California. Let them figure out how we're going to do the vaccine administration. So there's really a couple of different areas that's happening in. What we're seeing across the nation is mass vaccination sites, and I'm sure you guys have saw it too, right? At the Shot and Seed Center in Columbus, out here at Dodger Stadium, Padre Stadium has been a vaccination site. So we work with a few government contractors, and we provide the clinical staff for those large pop-up locations. And that's a big business for us right now. But our challenge is that these sites, they get put on hold on no notice. Like last week on Thursday, they stopped doing vaccinations altogether on Thursday because they ran out of doses. So we've got supply problems, but we also have equity problems. And unfortunately, the equity problems are not specific to vaccines. The equity problems in healthcare have existed for years. Underserved minority groups not having the same kind of care, that a white person would get. And then now we look at the vaccine rollout, and it's usually wealthy white communities that have been fully vaccinated when minority groups are struggling. So it's not, and the reality is that it's not just a vaccine problem. That's been the issue since before vaccines were even rolled out. So there's a lot of opportunities that we're seeing right now in terms of that health equity field. And we talked about it a little bit earlier this week, is a lot of the initiatives that companies wanted to do prior to COVID were put on hold, but they're really the things that will allow an organization to be successful after COVID. So it's kind of this catch-22 of, well, we want to make sure we're financially solvent, but we also want to try to invest in moving things forward where we want, but we don't have the resources to do it. Money's super tight, patient volumes are down. So there's a lot of challenges. I do not envy anyone in a leadership role in healthcare right now because it's unprecedented and no one has the answer. So
yeah, it's like I say, the tracks run very deep,
Exactly.
It's going to be quite a job to rip all those tracks out and start realizing we don't have to do that stuff the same old way. We keep working the old system, trying to make it better.
Yep.
It's so limited. It's just not going to be able to support the way that things are going to be. So
yeah.
The other thing is, you look at this, the banner here, Scrappy is the new perfect. There's a certain level of Scrappy is the new perfect that works. But when we're talking about getting the right vaccine into the right hands and the right timing, and the right delivery, that cannot be Scrappy. So how do we look at certain aspects of the new world of work? The remote opportunities are one thing, but accelerating change to rip up those tracks and make things happen that are in the 21st century and beyond, it takes time.
Yeah. Well, to talk about Scrappy, I've got a great example. We have a customer that wanted to put together a pop-up COVID testing site, and they didn't have any security guards. They just didn't have it. We had two of our recruiters go on site at the client and act like security guards. I mean, these are 20-year-old ladies that they're not security guards. They're really only there checking people if they have a badge or not. But it's just hilarious to think about, we gave our recruiters to an organization as security guards because they didn't have anybody. But that's a great example of why Medix has been successful in this whole situation, is because we're willing to do it. and we're willing to
You-
make exceptions and take a risk and say, sure, let's go do it.
You're willing to do what it takes.
It's part of our core values is actually willing to do what others won't. It's written on the walls of the building. So, those core values, I think, have allowed us to be successful in a time that a lot of companies that might have thought they had a good core culture have found out that it doesn't exist, or it doesn't stand the test of change and challenges and those kind of things. And we've seen tremendous growth because of the way that we've, I think, grown the organization from a culture perspective. So
Well, it's interesting you bring that up, because some of the things that Laura and I do with our work with organizations is built around values. And I think that the learning has been even more so than vision and mission. Values, if they stay the same or that everybody's on the same page, you can weather all kinds of change.
Yeah.
But if the values are not clear and they're not being adhered to, it doesn't matter. You're dead.
Well, the healthcare and other industries are changing. That's a strong statement. So what do you see in the changing landscape, Jeff, of healthcare?
Sure. So to answer that question, I think I would like to give a little bit of a precursor to say that this information is specific to the healthcare industry. That is what I know. It's what I sell. It's what I do. I don't do finance. I don't do manufacturing and engineering. I sell a little bit of it, but I'm no expert in that area. What I do look at is the healthcare field. And what I'm seeing is, to simplify it, is the same initiatives that they wanted to do prior to COVID still exist. The reality is that consumerism in healthcare is here to stay. And there's no way around consumerism in any industry, to be honest with you. With the increase of information available to customers, people always do their research. They always Google the company that they're going to go talk to, or go to take a treatment from, or go to have a meeting at, or whatever. They're going to do some research online. And what companies have realized is that the better they can appear to customers that are shopping around for healthcare services, the more services they're going to be able to render and the more revenue they're going to make. So there's been a huge focus prior to COVID about the quality of care. And we talked a little bit earlier this week about the change in the financial makeup of healthcare organizations moving from a fee-for-service model into this value-based care space. And for anyone that's not in healthcare, very simply put, previously, when you'd go to the doctor, they'd bill for everything that you could possibly do. They'd run every test available because they'd get paid for it. There wasn't really much oversight into what the equity, what the value of those tests really were. It was just, hey, they did it, so we're going to pay them out. Well, the insurance companies and the government have gotten wise to that, because there's been so many fraudulent billing situations where people just said, we have to run these tests, we're going to bill for it, and they just ramp up all the testing they can. Even for sometimes it's made up patients, which is not a great thing at all. That was a huge issue.
Wow.
So as they looked at it, it was part of the Obamacare rollout as well, is that they need organizations to be able to show that they actually provide value in the care that they're providing. So organizations that provide a high customer service focus, they have great patient satisfaction scores, along with quality of care. They actually show results. If you look up a star rating in an organization, it's basically how well they perform their healthcare. So organizations are constantly focused on how do they increase their marketability to patients, not only with their online presence, but word of mouth referrals, and also their relationships with insurance payers, because the better that they can actually show that they're improving the lives of patients, the more insurance companies are going to want to work with those organizations.
Sure.
Thus, the more money they get from insurance companies as well. So those things are very healthcare specific, but that's what's happening. It's what's going to be the big needs when COVID normalizes, or whatever we're going to call it. Those initiatives are going to come back to the front burner. They've been put on the back burner for a year now. And companies have been lagging behind on those initiatives. So that's one of the areas that I think is going to be a huge need for healthcare organizations, is anything in regards to quality and value-based care are huge needs for anyone that's involved in healthcare right now. So that's something.
Yeah, that's a great summary. And the other thing that certainly we talk about, and we introduced the whole discussion today with a headline of the future of hiring. So with all of that going on, impacting the future of hiring, I mean, look at what's happened with video interviewing. I mean, there are so many people who have segued to that fairly easily, but there are others who are really struggling. So it's a way to look at the whole landscape moving forward.
Well, what I hear, one of the things that I hear you saying, Jeff, is that along with all of the skills and abilities that people already have, the more they can have the opportunity to build their understanding and their implementation of things that are quality metrics oriented, the more valuable they'll be in the hiring process.
Exactly. And I don't think for anyone, just to speak to that point, Dad, like I'm no expert, I'm not an expert in healthcare finance, but when I'm talking to a VP of revenue cycle and I know what the pressing issues are of a company, I can speak the language. And I think it's important for candidates to know the bigger picture and to see, what the bigger initiative is that their role can help. I think that really sets apart candidates are ones that have a kind of a more holistic understanding of their job. It's not just the job they do, it's what that job does for the organization. And the more they can kind of articulate that in their interview, the more they're going to float to the top of the candidates that are available.
Yeah. Well, I think you see this happening all the time now, because every time you do anything, I had GE Appliances come and fix the stove the other day. Within 5 minutes, I had 3 emails asking me if my service was good.
Exactly.
So, everything is geared towards that quality orientation. I think healthcare is going to go through the same revolution.
Correct.
The future of Yelp.
Yeah, exactly. It's Yelp for healthcare. I've heard executives say that before. And I think that doesn't apply just for healthcare. I think, again, I told you that I'm not the expert in other industries, but the reality is that same kind of thought process and methodology is going to be apparent for every sector. I mean, if you even look at financial investing, you're going to look at the company and see how well what the reviews are, how well people have seen success, and then you're going to make your decision on where you're going to spend your money and time. So I think it's only going to continue, and it's going to permeate other industries as well outside of healthcare.
Fascinating.
We could go on forever, and we want to, in looking at the time, we want to wrap things up, and we can certainly continue this conversation going on future netcasts. But I think it's all looking at having these conversations so we can keep up front and center about how to help people transition. So we know that change is ongoing. Transition affects everybody differently. And these ongoing conversations are really going to be very valuable. And it's good for all of us to think outside the box and think in different ways. So anybody who would like to reach Jeff directly, there is his email. If any other information about WorkLife overall, of which Jeff is also a part of, there's the scroll below. But thank you all for joining us today. And these are fun. Any topics that you'd like to hear us dive into, please leave a comment. We're happy to engage and have other guests and continue the dialogue. So thanks for joining, everybody.
Thanks, everybody.
Great to have you.